If you have a torn meniscus, you might be worried it's the end of living the active life you love, whether that's playing a sport, working out in the gym, playing with kids or grandkids, or just going on hikes and walks without pain. You might also be wondering if surgery is necessary and what that might look like. And in this video, I'm going to answer that question with some research and share the key concepts you need to understand, including 5 exercises to recover from a meniscus tear for good. If you're here and you've torn your meniscus or you suspect you've torn your meniscus, then strap in because this video is going to teach you everything you need. And what I'm going to share with you is based on not only my own experience of tearing my meniscus twice in 2 separate events, but also helping clients overcome meniscus tears from sport. The first question you should be asking yourself is, how do you know if you've torn your meniscus or not? Well, there's a few different ways that you can determine that. Number one is, did you do something where you're playing a sport like soccer and you're running, you cut, plant hard on the ground, and then you pivot, and then you feel your knee go, maybe there's a pop, you feel a tear or something, and right away you get pain and you get swelling. That's a good sign that you have a meniscus tear. You might also have a ligament tear. So if you've had a very traumatic injury where you were helped off the field or ice and you're hobbling, you couldn't put any weight on your knee, you need to get that checked out right away. But there's a really good chance that you have a meniscus tear. And that's the most common mechanism of injury. It's planting, pivoting hard, and if your foot catches, especially if your foot catches like you're in a pair of soccer cleats, that is a recipe for meniscus tears. Another way that people tear their menisci or meniscuses is getting down deep into a squat explosively and bouncing out of it. Olympic lifters, those guys and girls can tear meniscus that way. Now, maybe you didn't suffer from a really traumatic event like that, but you did something, a small little move, and that could have contributed to a furthering of a tear that was already present. And we're going to talk about some research that shows how common meniscus tears are. To determine if you have a meniscus tear, you can just feel around your knee, and on the inside of the knee, you feel between the bones, there's a little bit of a groove, and you just drive your thumb down and push around that area in between the 2 bones, the tibia and the femur. And if you have pain in there, that's called the joint line, there's a good chance you have a meniscus tear. And the medial meniscus, the one on the inside of the knee, is the one that is most commonly painful. The last thing you can do to test yourself, if you'd like, is you can bend your knee and you perform tibial external rotation. And if that hurts, your medial meniscus is likely torn, and tibial internal rotation. So I'm rotating the lower leg, and if that hurts, it's your lateral meniscus. But again, the most common meniscus tear is of the medial meniscus. What's very interesting is that a lot of people have meniscus tears, but they don't have any pain or symptoms. For example, this systematic review included 63 studies looking at a total of 5,397 knees. And they found that 4% of those under 40 had meniscus tears, while 19% over 40 had meniscus tears. And again, these people were completely asymptomatic, meaning they had no pain, even though they had meniscus tears on MRI. When it comes to athletes, I found another systematic review that looked at 295 athletes with an age range of 14 to 66 years and a mean age of 31.2 years. And they found that the overall prevalence of meniscus tears in athletes that were asymptomatic was 31.1%. So basically, if you're an athlete, there's a 1 in 3 chance that you have a meniscus tear. And if you're not an athlete, but you're over 40, there's a 1 in 5 chance. Now let's talk about surgery, because surgery for meniscus tears is very common, although it's getting less common nowadays because of new research that we have. This recent Cochrane systematic review included 16 trials and 2,105 participants with an average age of participants ranging from 46 to 65 years old. And after analyzing these studies, the authors state that arthroscopic surgery provides little or no clinically important benefit in pain or function, probably does not provide clinically important benefits in knee-specific quality of life, and may not improve treatment success compared with placebo. They also state that it may lead to little or no difference or a slight increase in serious and total adverse events compared to control. But the evidence of this is of low certainty. Based on this, I can confidently say that you shouldn't just jump right into surgery if you have a meniscus tear. However, there are 3 situations where surgery might be the best option. Number 1 is if you have a bucket handle meniscus tear, that prevents you from fully extending your knee. Fully extending your knee is critical to keep your knee overall healthy and prevent further degeneration and arthritis. So this is something you should seriously consider. Number 2 is if you have a meniscus tear with an associated ligament tear. And number 3 is if you're under 40 years old and you had a traumatic tear, like you were playing sports and you tore your meniscus, and that meniscus tear is through what we call the red zone, which means that there's a good blood supply there. If you fall into any of these 3 situations, then you should definitely talk to your surgeon and consider the surgery. If you don't fall into one of these 3 categories, then what do? Well, first, if you have really severe acute pain and swelling, your number 1 goal is to eliminate the swelling and decrease that acute pain. We want to get your pain level to at least a 6 or below before we start doing exercises that can really help to restore function and fix the root causes that cause you to have a meniscus tear in the first place. And there are 3 steps to do this. The first is to avoid aggravating the torn meniscus and increasing that swelling. So how do you do that? Well, you could keep off the leg and use crutches if necessary. However, what is useful for most people is that you can find the range of motion that aggravates the knee, so that increases pain. And let's say you can fully straighten your knee, and when you bend your knee, your pain starts to increase about there. We know that that range of motion we want to avoid. So we keep all of our movements above that amount of knee flexion. So again, if you're bending your knee and your pain starts about here, we don't want to do anything below that range, because anything below that range is going to further pick at that scab and it's never going to be able to heal. So you've got to avoid anything that increases your pain. One thing that I found from my meniscus tears is if I was sitting down and I was crossing my legs, so just sitting, when you cross your ankle across your other leg, that would put a really low level of strain on my knee. But then when I'd stand up, my knee would ache. And I would wonder, why is my knee hurting more now? I was just sitting down. But I realized it was because I was crossing my leg, and that causes that rotation through the knee that recreates the mechanism of injury. So avoid crossing your ankles like that. You could cross your leg like so possibly, but if it bothers you, just avoid it. Just sit straight. That's the best bet. Likewise, when people stand, they sometimes stand like this. Feet are turned out, torqued on one leg. Don't do that. Just stand, feet pointing straight ahead, and that'll minimize your risk of aggravating that meniscus. The second thing you can do is ice or contrast therapy, or better yet, do both. Ice for 15 minutes, 2 to 3 times a day, and you can do contrast therapy just when you go in the shower. 30 seconds hot, 30 seconds cold. Do that 5 times, and that's going to help to pump the blood back up to the heart and get rid of the swelling in that knee. Third and final thing that you can do and you should do is activate your quads, specifically the VMO. So if you're sitting down and this is the torn meniscus, really simply, I can rest my leg on my other foot just to keep it slightly bent, and then kind of poke on the quad and contract the quadriceps muscle, trying to make this part of the quad, the VMO or vastus medialis, trying to get this contracted. So you tap it, you poke it, you squeeze it, and contracting the muscle does 2 things. It, 1, helps to eliminate the swelling, the muscle pump, and 2, it ensures that this muscle, which can often atrophy and get weak and shut off after a knee injury, it ensures the muscle stays active and strong. So it doesn't get weaker, which further prolongs your recovery. So you contract it, hold it for 10 seconds, do that 3 times and do it a few times a day. So 3 reps, 3 times a day at least. The more you do it, the better. And that'll keep that muscle on and help to eliminate the swelling. If you've successfully eliminated your swelling and gotten your pain level to a 6 or below out of 10, it's time to start the following exercises. And the 5 exercises I'm going to show you today are a sample of exercises that get to different root causes of meniscus tears. The bottom line with all of the root causes that I'm going to discuss with you as I go through the exercises is that when one of or more of these things is lacking, it puts more load and more stress on the knee. And when that happens, something is bound to break. So the first technique we're going to go through is ASMR, active self-myofascial release, for the posteriormedial knee. And what this is doing is it's going to address a problem where the hamstring tendons, gastrocnemius tendons, and even the adductors can get stuck together and fibrotic and stuck to the medial meniscus. And when that happens and you're moving around, it pulls on the meniscus, and that can increase the load through the meniscus, causing it to tear. So for this technique, you start with your knee bent, and you can see kind of the tendons here. Here's my hamstring tendons right here. You just want to kind of grab in that area with your thumb and your index finger, and then you straighten your knee out. And you're just digging your fingers into different areas around the knee, not right on the joint line or right on the meniscus, but right around it as you straighten the knee. So you stick your fingers in there. You can grab the tendons with your fingers. Just make sure your nails are cut so you don't drive your nails into your skin. And you work it for 1 to 2 minutes. And it's a good idea to do both knees because this can happen on both sides, and you don't want to tear your other meniscus or both at the same time. So you work this for 1 to 2 minutes to make sure that the meniscus is not stuck to those tendons, causing it to tear. The second exercise we're going to go through is one of my favorites, called the extended knee ankle flex. And why I love this exercise, not only for meniscus tears, but just overall health of the knees and the feet and the ankles, is that it helps you to activate the vastus medialis muscle, which can often get sleepy and is also related to the vastus intermedius, which is the deep quadricep muscle that you can't see, that's under the other 3 heads. And it also works your ankle dorsiflexion range of motion. And the final thing it helps you with is training terminal knee extension. And that's when your knee is fully straightened out and stable. For this exercise, you get a foam roller or a pillow or rolled up pair of jeans, something that's fairly firm. And your knee is bent. The roller is just above my knee line. And from here, the first thing I'm going to do is activate the quadriceps. So I activate, contract the quadriceps as hard as I can without over contracting the hips. So you keep your butt planted down on the ground, contract those quads. Once they're contracted fairly strongly, you slowly straighten your knee to full terminal knee extension. Now, if you're hypermobile, don't go past straight. Don't go into hyperextension. Just go to straight and hold it there. You keep your quads on, and then you go into plantar flexion. So I'm pointing my ankle down, not necessarily curling my toes a lot, but pushing my foot down. So I'm contracting my calves to do that, but keep the quads on and keep my knees straight. Hold that for about 5 seconds, and then you switch to dorsiflexion. So pull the foot up. Again, I'm not worrying about my toes so much. I'm just trying to close that angle between my foot and my shin bone. Quads stay on, keep the knee at terminal knee extension. After 5 seconds or so, go to neutral ankle, keeping the quads on, slowly lower down, because I want to train that control and stability through the full range of motion. And once I land on the ground, then I slowly let the quads relax. And that's 1 repetition. Again, this addresses multiple potential root causes of meniscus tears, which are weak VMO, poor ankle dorsiflexion, and a lack of terminal knee extension and stability at terminal knee extension. So this exercise you should do not just during your rehab, but this is something you should do if you're moving around on your feet for the rest of your life. And again, do both sides. Keep both sides healthy. The third exercise is the 4-way MTP slide. And the MTP stands for metatarsal pressure. Your metatarsals are right here. And you want to maintain that pressure on the floor as you do this technique. And what this does is it gets the intrinsic foot muscles, that's the deep muscles in the feet, activated and contracted, while it's in different positions of the ankle. So we're working dorsiflexion, plantar flexion, inversion, and eversion, the 4 movements of the foot and ankle that are really important and are not often trained in conjunction with the intrinsic foot muscles being on. So it works muscle activation, the range of motion down at the foot and the ankle. It also works the range of motion at the hips, that internal and external rotation of the hips that I mentioned is so important for keeping your knees healthy, not just from meniscus tears, but other ligament tears and just general overall knee health. For this technique, you need a slippery floor. So I've got the wood floor here. I'm just gonna throw this little towel on the floor, and now it's nice and slippery. You could have socks, but you gotta figure it out. If you're on carpet, maybe you need a frisbee or something flipped upside down, or a slider board. From here, I'm going to press down and activate those intrinsic foot muscles, contract those intrinsic foot muscles by doing a short and skinny foot. So I pull the forefoot in towards my heel, and I make the foot skinny across the metatarsals there. So now the muscles are on, and I'm doing 4 ways. So I'm gonna straighten it out first, keeping those muscles on, go as far as I can, keeping the foot flat, and hold it there for a couple seconds. And then I pull it in into ankle dorsiflexion, keeping the foot flat, hold it there for a couple seconds. And then I go to 90 degrees at the knees and slide it out. So now I'm doing inversion at the foot and ankle and internal rotation at the hip, working 2 important ranges of motion for knee health. And then I slide it inwards, that's hip external rotation, and foot eversion. And hold that for a couple seconds. And then I repeat. That's 1 rep, and then I repeat. The other cool thing about this exercise is that you're working the full range of motion. You're not just working the positions, but you're transitioning and sliding in and out. That way we're developing this activation and control through the full range, which is necessary for whatever it is you're doing on your feet, because you don't know what position you're going to be in at the feet and the ankles, at the knees and the hips. And this way we're working to stabilize and be strong in all of those different ranges. The next exercise is to restore your knee flexion range of motion. So when you hurt your meniscus, you're going to be limited in knee flexion, which is this. You might and probably won't be able to get that calf right to your hamstring. So you'll be stuck somewhere around here or maybe here, depending on the significance of the injury. So this exercise is going to help you get that range of motion back, that knee flexion range of motion. So what you're going to do, it's a very simple exercise. You start off lying down on your back, and then you just bend your knee to the point where there's no pain. Right before pain and limitation kicks in, you go right before that. So let's say pain is here for me. I would work just down there a little bit. And if you can keep your foot flat, then do it. That will help us to activate those intrinsic foot muscles again. So here, this is the range I'm working. All I'm doing are 3 muscle contractions. The first one is pulling the floor towards my butt and keeping even pressure on underneath my pelvis. So I've got even pressure under my pelvis. I'm pulling the foot towards my butt to activate and contract the hamstring muscles. Hold that for 10 seconds. My foot muscles are on here because my foot is flat, so I can do that. So after 10 seconds, I push the floor away from my butt. And this time, I want to contract the quadriceps. Now, for this one, what might help, depending on the angle of your knee, is you think of lifting your foot off the floor against your other, you block it with your other foot. So there, I'm contracting the quadriceps at the same range of motion for 10 seconds. And then I'm going to finish off with the hamstring again. So pulling the foot towards the floor. You notice there's no movement at the knee. The angle doesn't change with the knee. I'm just activating the muscles here at this range of motion. It's an isometric muscle contraction. Hold that for 10 seconds and then relax. And what we're doing here is we are actively stabilizing and contracting the muscles at that range of motion, just below the range of motion that's painful. And by doing this, we are restoring strength and stability to this range, but also the range that is painful. Because whenever you contract your muscles at a certain range of motion, there's a window above and below that range of motion where you get that strength transfer. So by working just below the painful range, we're not irritating that meniscus and risking re-aggravating that injury, but we are restoring the strength to the range that is needed to restore the range that you've lost and that's limited right now. So this is really going to help with your rehab and recovery and restoring that range that you will need, whether you're playing sports like soccer or basketball or hockey, or you're working out and doing lunges and squats in the gym. The fifth and final exercise I have for you today, I call the midline lunge. With this exercise, you do not want to push the range of motion. So again, that test that I taught you earlier, where you test what range is painful and you stop just before that range, that applies to this exercise. Now, you might not even be able to do this in the first week or two, whereas you could do the other exercises. So don't stress. Add this in when you feel comfortable. For this technique, you need a band, some kind of resistance band that you can step into, and that pulls your knee outwards. And this is opposite to a lot of the traditional physio rehab exercises where you have the knee pulling in. And the reason why I've got it set up this way is because this activates the foot muscles. It activates all of the deep hip stabilizer muscles to keep your good alignment, to fight this valgus knee posture. So we set up in the lunge, my pelvis, my hips are square forward. I step back a little bit. The resistance band is pulling me slightly out there. It's not very strong. It's not a super tug to the outside. From here, all I'm doing is I'm lunging down and I'm stopping just short of the pain, making sure that my foot is pointing straight ahead and my thigh is pointing straight ahead with my foot. So there's perfect alignment through the legs right there. And then I stand up to full knee extension. Again, I'm going down, lunging, stopping right before the painful range, and then I'm straightening myself up. And when I do this, I want to make sure my foot muscles are on, those intrinsic foot muscles. I'm keeping good posture and alignment up top as well. And again, the most important thing is foot point straight ahead and thigh point straight ahead. And just go nice and slow like this. And that's going to develop strength through the full range of motion. And that will protect that knee and will allow you to keep that alignment as you go into everyday activities like walking up and down stairs. Summarize the routine we just went through. We started with ASMR for the posteriormedial knee. Do that for 1 to 2 minutes per side. Then we moved to the extended knee ankle flex exercise. Do 2 sets of 4 reps per side, holding each rep for 5 seconds. Next, we went to the 4-way MTP slide, performed 2 sets of 3 reps per side. Then we went to the knee flexion ERE technique. Do 3 reps per side, holding each contraction for 10 seconds. And we finished off with the midline lunge, do 2 sets of 6 reps per side. Perform this routine 3 times a week for 2 to 4 weeks, and then it's time to move on to further build strength and range of motion. So there you have my approach and the reasoning behind my approach to dealing with meniscus tears. And if you didn't know, you've just gotten a little masterclass on how to effectively deal with any injury. And that's based on my 4 pillars to pain-free movement, which are tissue quality, muscle activation, alignment, and active range of motion. And these pillars are what you need to keep moving freely and without pain for the long term and to address the root causes of problems, not just putting band-aids on. So if you like that approach, let me know what you thought. I've got a couple other resources here for you. These 2 videos that are related to topics we talked about already. And if you have a meniscus tear and you want to make sure you do the best for it, then get the knee pain solution program that you can find inside the ROM Coach app. And this takes you through many more exercises and progresses you through multiple phases to fully address all of the root causes for long-term results.